At this point, you guys can all tell the difference between a sagittal and a transverse view. A lot of you guys have asked me to open up your imaging assignments, and I will. I'll go ahead and open all of them up for abdomen and OB so you guys can review them, but don't only study those, okay? I'm not only going to give you guys the images in these assignments. There can be images outside of this, okay? So just a heads up on that. Obviously we went over this today, but again, an accessory spleen, this is just a normal congenital anomaly. This is a normal variant. This will not cause any abnormalities within our patients, okay? All lab works, everything else, everything will still be normal. Obviously, splenomegaly should be an easy one that everybody should be. I'm not going to give you these images and expect you to tell me polycythemia vera because there is no definitive view of polycythemia vera. It just causes the spleen to get enlarged. That's what majority of the abnormalities in this chapter. So just be able to identify splenomegaly. Okay? Any of these abnormalities, like your myeloproliferative disorder, be able to sonographically describe these, right? You've got multiple hypoechoic masses running throughout the entire liver parenchyma. The spleen parenchyma, okay? On this one, you've got multiple echogenic foci taking over the entire splenic parenchyma. So sonographically be able to describe those. Splenic trauma should be another easy one, even though I didn't give it to you on this imaging assignment. Make sure you review these ones as well. If I give you a scenario, there's a patient that was in the car accident, they presented to the ER, and this is what we see, right? That's specifically telling you this patient just went through trauma, and you can clearly see that we've got blood starting to pool, so we have a hemorrhage occurring. So there is a hemorrhage right here. Obviously, this is all hemorrhaging occurring post-splenic trauma, okay? Here you can clearly see that we have a laceration across, so the spleen has ruptured. We have blood starting to pool here. Everybody okay with those? Same thing here, we have blood starting to pool here. This region right here looks like it is definitely different echogenicity, so there's some sort of loss of normal splenic tissue. Hamartomas are an obvious pathology. Unlike the rest of the pathologies with the spleen, this is, if you see a bright echogenic, well-defined mass on a spleen, that is a hamartoma, okay? So make sure you know this image. Since you can clearly put it apart from the others. The rest of the spleen, there isn't an obvious sign for it. Majority of it is, oh, we have splenomegaly. It can be this or that. So focus on this one since this is a clear example of what it will occur like. Okay, so clearly we have a well-defined borders. It's a well-defined echogenic or hyperechoic mass within the spleen. And in this image, not only do we have a mass, what other abnormality do you see here? You can clearly see ascites. And remember, for any sort of malignancies, if I give you images for malignancies, if you've got a mass with color, the more complex that it looks, the more isoechoic it looks to the normal parenchymal patterns, those are true signs that this is more than likely going to be a malignancy. That goes for anything. I could give you images from anywhere. If I'm showing you a mass that has extensive color flowing to it, it looks very complex, it looks very isoechoic, that should make you think, if the question is this benign or malignant, there are more chances of this being malignant than anything else. Everybody okay with that? Okay. Next we have the pancreas. Firstly, sonographically, obviously you need to know, but be able to identify the different regions of the spleen. So your uncinate process, your head, your neck, your body, the tail. So be able to identify those different components. Obviously, it will be in an ultrasound aspect, but still be able to identify them. Okay. Okay, starting off, firstly, what view are both of these images in? Are they in a transverse view or a sagittal view?
Transverse.
Transverse, right? You can clearly see when we are in a transverse view because look at the aorta, the IVC, the SMA. Those are your landmarks. You can clearly see that those are in a cross-sectional view. Yes? They are rounded. That proves that this is a transverse view. If the aorta, the IVC, is elongated, that means that we are in a sagittal view. So this is a transverse view and a transverse view. So in this image right here, you can see the uncinate process right here. This is the head, then it goes into the neck, the body, the tail. Everybody okay with that? Now remember your surrounding anatomy. The anechoic circular structure to the left of the patient is the aorta. Anterior to the aorta we have what? SMA. Here is the IVC. Between the posterior to the neck, we have what right here?
SMV.
SMV going towards the tail. What do we have?
Splenic
vein. Make sure you know those specific structures. So SMA, SMV, splenic vein, aorta, IVC, and possibly a left renal vein. Okay, remember renal vein, we'll look at it when it comes. So this is pointing to two structures. What is the one at the bottom? CBD. What is the one at the top? Gastroduodenal artery. I'm glad that I feel like the imaging assignments are just forcing you guys to review the images a lot more so you're not they're not shoved down your throat towards the end of the semester. These are just showing you different views of the same thing, so I'm not going to review them. But image B right here, or A it says, transverse or sagittal view. Look at the IVC. It's elongated, right? That should point you to the fact that this is a sagittal view, okay? Look at your aorta or IVC. Those are two structures that everybody at this point should know what they look like in transverse versus sagittal, okay? This is an example of an uncinate process, a good view of it, so you can clearly see we have the head right here, and here's the uncinate process. And in between both of those, we have the SMV running. If you're seeing the uncinate process and an anechoic center right above it, that means that that is the splenic, the SMV, not splenic vein. Yes. Right here. So when you see right here at the top, that is the head. And this tissue right here, that is the uncinate process. Okay? Remember those two hamburger buns like we like to talk about? That's the head, this uncinate process, and the actual patty is the SMV. Okay? This is another good view. Right here we have the aorta, and you can clearly see right above the aorta we have this tubular elongated structure. It's not coming off of the aorta. it's above the aorta, that means it's the left renal vein. If you follow this out, this will go to the IVC. So if there is a tubular structure above the aorta, make sure you don't label it as an artery. If it's an artery, you will see it come off the aorta, right? A vein is coming off of the IVC. So if you look right here, off of the aorta right here, there's a tubular structure here. What would that be? The left renal artery. But this one is not coming off of the aorta. This is your left renal vein. Okay. Again, SMA right above it, SMB towards the head region, and we can't see the splenic vein here. Okay. Everybody okay with that? What is the sonographic sign right here, guys? The Mickey Mouse sign. Make sure we know that. Here we have portal vein as the actual face. This is CBD. What is this one supposed to be? Hepatic artery. Okay. Being able to tell a duct versus a vascular structure. Remember, what was one thing I specifically said? Duct versus vascular. What will happen with a duct? Correct. Ducts have tissue on either side. So if you look at image B right here, you can clearly tell that this is a duct because you have pancreatic tissue above and below. And the below is not only in the head region like the uncinate process, it's going to run behind the body, the tail, the entire way through you have pancreatic tissue. Versus the image right here, this is a vascular structure because there is no pancreatic tissue over here. You can clearly see this is really bright and echogenic, right? That's not pancreatic tissue. You have pancreatic tissue here, but that's the uncinate process and it stops right there. So this is clearly a vascular structure. However, this tubular anechoic structure right here, that is the duct. Because you can clearly see we have tissue above and tissue below it. Everybody okay with that one? What would this structure be right here? SMA. What would this structure be right here? SMB. They have it mislabeled, guys. This is the SMB. That means this is the what? Splenic vein. So remember, from here, the splenic vein continues and it goes all the way to the spleen. For acute or chronic pancreatitis, just be able to sonographically describe them to me. So here you can clearly see we are more hypoechoic. It is slightly more enlarged. It seems very lobulated. Definitely more than normal. Okay. Same thing here. You can clearly see it's more hypoechoic, very complex in its appearance. So it's definitely enlarged. If you were to follow the spleen, it starts here. So here's the actual head of it. It goes all the way to the top and then it comes down. So you can see it is extremely thickened in this portion right here. Very complex in its nature. Yes, it's overall hypoechoic, but internally it is no longer smooth, right? It is a very complex. Here, if I were to give you this image and asking you what's going on here, remember that this is a ductal dilation because clearly we have pancreatic tissue above and we have pancreatic tissue below. Yes? So that is clearly an example of ductal dilation. And this duct is dilated because of this mass that is present towards the head of it. Normally we don't see ducts that are this dilated. The dilation causes it to look very similar to a vascular structure. So again, you should have pancreatic tissue on either side. And then once you guys get up to actual clinicals and things like that, if you have a patient like this and you're like, what's going on here? Is that the duct or a vascular structure? Put color Doppler on it. A duct will not light up with color. Okay, it's not carrying vascular fluids to or from, so it will not light up. versus your any of your vascular structures will light up. So put colored Doppler on it, and that should be able to distinguish one from the other. Okay. The rest of all of these are just, if I were to give you any of these images, they're essentially just looking at sonographically describing them more than anything else.